It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode, I answered another question in this series of questions from one of my clients, Melissa. And the question last week was part 8 of my 78-year-old mom has lung cancer and developed an infection. She's in ICU on the breathing tube. Can she get off it, or will she need a tracheostomy? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question in this series of questions from one of my clients, Melissa, which are excerpts from phone and email counseling and consulting sessions with me. And the question this week is part 9 of my 78-year-old mom has lung cancer and developed an infection. She's in ICU on the breathing tube. Can she get off it, or will she need a tracheostomy? You can also find previous questions answered from Melissa if you're scrolling down below this video in the written version of this blog, and you can click on parts 1 to 7. So after I started counseling and consulting Melissa earlier this year, her mum eventually left hospital after going from ICU to long-term acute care and then home eventually. A few months later, her mum presented back to hospital and got readmitted back to ICU because of the lung cancer having come back. The ICU team is adamant that Melissa's mum hasn't got much time left and that she will die very soon in the next few days. They have suggested hospice, and Melissa is having second thoughts about what else could be done. You can continue reading the dialogue below so you can see how I can steer the conversation in a direction to help Melissa to come to terms with her mum's situation and how she can make sure that she looks at the situation from many different angles so that she can actually do what's best for her mum. The reality is that when patients die in intensive care, the sooner you and your family can embrace the inevitable, and the sooner you are in a position to talk to your loved one and other family members about it, the sooner you can make peace with the situation, as is showcased in the dialogue below. So go and scroll down and read the dialogue between Melissa and myself, and if you watch this on YouTube, just click on the link below. That'll get you to our website and the blog where you can read the dialogue there. Thank you. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind the scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on the top of the website. Also, check out our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me over the phone, via Skype, or via email by clicking on the tabs on the top of the website where you can select from the options that work best for you. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update